Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's daily bulletin. The suspense on the exam date for NEET 2023 is finally over. According to the exam calendar released by the NTA, NEET 2023 will be conducted on 7th May next year for admissions to MBBS, BDS, Ayush and BSc nursing courses. The official notification inviting registrations from interested candidates will be released soon by the NTA examination, and the NEET 2023 application form will be hosted on the official website of NTA. Once the NEET 2023 application form is released, interested candidates can register through the official website by paying the prescribed application fees. For more details regarding this, you can check medicaldialogues.in. Calling out the World Health Organization for prematurely blaming an Indian company for the deaths without verification, India's drug regulator claimed that the samples of Maiden Pharma's cough syrup suspected of being linked to deaths of children in Gambia were not contaminated with DEG and EG and have been found to be of standard quality. In wake of this confirmation given by the DCGI, Maiden Pharmaceuticals Limited on Friday said that it will seek clearance to reopen its factory as the Indian government laboratory found nothing wrong in samples taken from syrups. Harvard bioengineers have invented the first Vagina-on-a-Chip. The inch-long device contains living human vaginal tissue and a microfluidic system to deliver a flow of estrogen-carrying material. The aim is to test new drugs for treating bacterial vaginosis, a common infection caused by an imbalance of certain bacteria in the vagina. The condition can increase the chance of getting a sexually transmitted disease and can cause pregnant people to deliver prematurely.
Thanks to advances in cancer therapies, most forms of breast cancer are highly treatable, especially when caught early. But the last frontier cases, those that can't be treated with hormone or targeted therapies and don't respond to chemotherapy, remain the deadliest and hardest to treat. Tulane University researchers have discovered for the first time how these cancers persist after chemo and why they don't respond well to immunotherapies designed to clear out remaining tumor cells by reviving up the immune system. With modern therapies for heart failure with reduced ejection fraction, acronymized as HFrEF, some patients can improve their cardiac function during treatment. But despite this improvement in the ability of their hearts to pump, these patients with so-called heart failure with improved ejection fraction remain at high risk for adverse outcomes. Unfortunately, they have been excluded from virtually all clinical trials in heart failure, and there has been little evidence about how best to improve clinical management for this growing patient population. Now, researchers from Brigham and Women's Hospital, a founding member of Mass General Brigham, and collaborators from the University of Minnesota and the University of Glasgow have conducted an analysis that suggests that this patient population may further benefit from initiation of the SGLT2 inhibitor dapagliflozin. This heart failure medication has received attention after presentations earlier this year on data from the randomized controlled DELIVER clinical trial. Researchers from Rutgers Robert Wood Johnson Medical School's Department of Urology have traced a previously observed link between microscopic organisms in the digestive tract, collectively known as the gut microbiome, and multiple sclerosis or MS. Their study in genetically altered mice and people supports the belief that dietary adjustments such as increased fiber may slow MS progression, and they are already working to test the effect of dietary interventions in MS patients. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.